is pain-free. You can do anything you want. You wouldn't feel a thing. So the patient's awake. You drop this electrode down and target an area. I'll show you where it is. You bring the leads all the way down under the skin to the chest, and then you have a little battery pack, and you just zap yourself, sometimes continuously, depending on the target, sometimes 4 or 5 times a day. And in the best of cases, pain just disappears, melts away. I have some movies of patients. It's quite dramatic. Does it always work? No. Can you predict when? No. Is it for everybody? Absolutely not. But when it works, it's dramatic. But what it tells us is that there is a system in the brain. It's not a placebo in this case. We're pretty certain of that. And we know how it works. I'm going to just show you a diagram. We talked about information coming into the brain and going up to and causing pain. Well, it turns out that there are control systems in the brain that act down to shut off the information that goes back to the brain. And that's what's happening. So you target an area in, names aren't important, in the midbrain of the brain. You stick an electrode and you zap it. When you do that, you activate a control system. There's a big minus sign here that literally shuts off the spinal cord. But selectively for pain inputs. You can still walk, you can feel touch, but you don't feel pain. It's not selective, it blocks it everywhere. Most interestingly, it doesn't work very well for acute pain. You can still feel pinprick, but you can't, if you have chronic back pain or something like that, it can actually eliminate it. Now, what's exciting about this and dramatic and why we learned how it works is that it turns out if you inject a drug called naloxone, which some of you may know as Narcan, the trade name, the pain relief disappears. You stimulate in the brain, you give this drug, and the pain comes back. Does anybody know what this drug is? This drug is an opiate or morphine antagonist. Somebody comes into the ER on Saturday night in a coma, you immediately give them Narcan. It should be called Narcant. I don't know where they came up with the name. It's Anyway, the point is, what does it do? The likelihood or the fear is this was a heroin overdose. Heroin is an opiate. The patient is in respiratory depression. You give them naloxone, they're up in a second because it just kicks the heroin off the opiate target, and the patient literally just wakes up instantly. Well, it turns out that same naloxone will block brain stimulation, produce pain relief. So how does that work? Well, I got to take a little segue, and let's talk about endorphins. So we have opioid receptors, or opiate receptors. These are the molecules, the locks, if you will, that are hit by morphine. But they're also hit, they're not there because people were shooting up morphine. That's not how it works, all right? What happens is there are endogenous compounds that bind this, and of course, these are the famous endorphins. Everybody's heard of endorphins? I'm going to dispel, unfortunately, I'm going to disappoint you when I tell you what I think of endorphins in a minute. But endorphins act on opioid receptors. And that's what happens. When they bind, they trigger a whole variety of reactions in the brain. These are endogenous. They're made by the brain. And naloxone will block it. That's simple. Conclusion? The conclusion is straightforward then, that when you stick an electrode in the brain and stimulate, you must be releasing endorphins and then turning on this control system. So you're tapping into an endorphin system. You're literally tapping into it, releasing the pain-relieving substances, and poof, you get pain relief, and it's blocked by naloxone. Is that clear? Pretty straightforward. You have a pain-relieving system in your brain. Naloxone's the key. Now, how does morphine work then? Well, then it gets simple, because if we have endorphins in the brain and they bind this, I can inject something from the outside, like morphine or OxyContin or codeine or Percocet. All those are opiates. They bind the receptor. They're exogenous, and you end up with pain relief. It's that simple. So what we believe happens, here's the brain, here's the spinal cord. Somebody comes in, and now I'm going to give them a shot of morphine. I want to block pain. How does it work? The morphine is given systemically, which means it's going to distribute throughout the body. Could be in a muscle, could be subcutaneous, could be an oral pill, could be intravenous. Doesn't matter. It's going to go everywhere. It's going to bind the same place where the brain stimulation was. It's going to shut off the spinal cord, and you're going to get profound pain relief. Great drug. Severe pain, morphine is the drug of choice.